Hello, my name is Monica Aguirre, and I am a Family and Community Health Agent with Prairie View A&M University Cooperative Extension Program in Bexar County. Today we will be talking about important information we should be aware of concerning colorectal cancer. How many of you know someone who has had colorectal cancer? These are cancers of the colon or the rectum, so you may have heard it called colon cancer or rectal cancer. Cancer affects millions. Each year, more than 8 million people die from cancer worldwide. Cancers are the second leading cause of death in the United States. Breast, cervical, and colorectal cancer are common and at least in part preventable. Let's start out by talking a little about who it affects and the screening guidelines. Our goal today is to talk about the importance of screening for colorectal cancer, the American Cancer Society guidelines on nutrition and physical activity for cancer prevention, and how to apply these guidelines to real life. Let's take a closer look at exactly where colorectal cancer is found. The picture on the right is some of the organs in the digestive tract. The purple area is the large intestine, which consists of the colon, about 5 feet long, and the rectum, about 6 inches long, and is the area in which you will find colorectal cancer. 70% of the cases arise from the colon and 30% from the rectum. Colorectal cancer starts with polyps or growths in the intestine and rectum. As the growths get bigger, they can become cancer. Here are some important facts about colorectal cancer. Colorectal cancer is the third leading cause of death of cancer in the United States. Average risk of colorectal cancer is 1 in 20 people. Risk is 2 to 3 times higher in people with a first-degree relative who have had colorectal cancer, and 90% of colorectal cancer is in people 50 years of age or older, and there are over 1 million colorectal cancer survivors in the United States. In Texas, it was estimated that there were 9,680 new cases in 2016, and that 3,520 people would die from colorectal cancer that year. In the United States, more than 70,000 people will be diagnosed with colorectal cancer each year. The sad thing is that 1 in 3 adults who are over the age of 50 is not being screened for colorectal cancer. Signs and symptoms of colorectal cancer are the following. Changes in bowel habits like diarrhea, constipation, narrowed stool. Also, sensation of needing to have a bowel movement that is not relieved by doing so. In addition, rectal bleeding or blood in the stool or black stool. Cramping or steady abdominal pain, weakness or fatigue, anemia, weight loss with no known cause, and then there's sometimes no symptoms at all. So as we mentioned, there are symptoms to look out for, but at times you may have no symptoms. Screening or the testing can find cell changes before they become cancer. Screenings look for blood in the stool, polyps or growths in the colon or rectum, or they can look for actual cancer. So let's talk about screening for colon cancer. There is more than one way to get tested, but all people 50 years of age or older should get tested. You and your doctor will choose the test that's best for you. If you have a family history of colorectal cancer, your doctor may decide to start testing earlier. There are several tests that can be done. These are a couple of tests that look for blood in the stool. This can be an early sign of problems. Then there are tests that look inside the colon for polyps or growths or other signs of cancer. The tests that detect blood in the stool are shown at the top. They are often called the FOBT or FIT tests. Samples of stool or feces are checked for blood, which might be a sign of a polyp or cancer. The FIT DNA test checks for certain abnormal sections of DNA or genetic material from cancer or polyp cells in the stool. The tests that look inside your colon are shown at the bottom. In the sigmoidoscopy, a flexible lightened tube is put into the rectum and lower colon to check for polyps and cancer. Sometimes doctors will choose to do this test along with the FOBT test. The double contrast barium enema is an X-ray test of the colon and rectum. You drink a milkshake-like beverage that coats the colon and the rectum, and then your doctor uses an X-ray to look at your colon. A colonoscopy is probably the one you're most familiar with. In this test, you have to drink a beverage the day before, and then a longer, flexible tube is used to look at the entire colon and rectum. This test is usually done every 10 years or more often if you have a family history of colorectal cancer, you've had polyps before, or for a few other reasons. The FOBT test looks like the picture on the left. You're given 3 cards to take home, and you use the sticks to place a small sample of stool on the card. You then mail the card to a lab or bring it back to your doctor's office. It's usually done once a year. The FIT test looks like the one on the right. It's pretty similar. You typically get 1 or 2 cards at home to provide a small sample with. Again, you mail the cards to a lab or bring it back to your doctor's office. The FOBT and the FIT tests can tell your doctor if you may have cancer, but they cannot remove the polyps. These tests may be a way to monitor you for cancer that doesn't require trips to the doctor. If something is found with the tests, then the doctor can order other types of tests that are more invasive. These tests are becoming more popular, but the colonoscopy is still the recommended test for finding colorectal cancer. The reason for this is that the doctor can find polyps or abnormal cells during the test. It can be removed right then, which is convenient. It's also just a better test. So even if you have the FOBT or FIT annually, your doctor should still do a colonoscopy at least every 10 years once you're 50. So what can you do? Well, you can get screened for colorectal cancer. If you're over 50, you should be getting a colonoscopy at least once every 10 years. Your doctor will determine when to start these tests and whether or not to do the colonoscopy, the FOBT or FIT test, or some combination. Also, encourage others to get screened. If you or a loved one has colorectal cancer, tell your doctor and share your story. It will encourage others to get screened. The American Cancer Society has 4 guidelines that can help you have a healthier lifestyle and reduce your risk of getting cancer. 1. Achieve a healthy weight. That may mean trying to lose a few pounds or maintaining your current body weight. 2. Eat a plant-based diet. 3. Drink little or no alcohol. And 4. Be active as much as possible throughout the day. A healthy weight is the weight you achieve and maintain with healthy eating and regular physical activity. This does not mean you need to be super skinny. In fact, being underweight may just be as unhealthy as being obese. Let's take a moment and look at the BMI chart. Find your height and your weight, and note what your BMI category is. You may be surprised or feel like you have a long way to go, but small changes can make a big difference. Even if you are not overweight, having fat around the waist seems to be particularly harmful. Ideally, if you're a woman, your waist size should be less than 35 inches. Men should keep their waist at around 40 inches. If you are interested, you can measure your waist at home with a soft measuring tape. It's important to know that no specific diet or exercise will target your waistline, but regular exercise and a healthy diet should help you slim down overall. Eating better and losing weight may seem difficult, but using a guide like My Plate can help you eat the right foods in the right amounts. My Plate, the food guide from the USDA, shows you what your plate should look like at each meal to help you choose a variety of foods. My Plate can also help you eat the right amount. You have probably heard that eating fewer calories will help you lose weight. But following My Plate, you will fill most of your plate with foods like fruits and vegetables that are full of nutrients like vitamins, minerals, and fiber, and are naturally lower in calories. Just remember to prepare all of your foods without extra fat and sugar. Using a 9-inch plate can also help you decrease your calorie intake because you will eat smaller portions. A person's diet pattern plays a significant role in cancer risk and death for cancer, because what we eat may determine whether abnormal cells become cancer. The American Cancer Society recommends a plant-based diet. A plant-based diet simply means filling your plate with lots of fruits, vegetables, and whole grains at each meal. Notice that My Plate is a good model for this concept. It is also recommended to choose plant-based sources of protein, sometimes and limiting red and processed meats. Eating too much red and processed meats increases the risk for colorectal cancer. They are also associated with 10 other cancers. Because of these risks, the American Institute for Cancer Research recommends eating less than 18 ounces of red meat per week. This is a weekly calendar to show you what 18 ounces per week might look like. You could have 3 ounces of red meat 6 days per week, as shown on the first row of the calendar. On the other hand, the second row of the calendar shows that if you ate a 12-ounce steak at a restaurant for Sunday dinner, then you would need to cut back on the red meat for the rest of the week. However you choose to split it up during the week, to meet the guidelines, we want to eat less than 18 ounces of red meat per week. The other part of the recommendation is to avoid processed meats as much as possible. Some examples of processed meats are things like lunch meat and cured meats like ham and bacon. There is a strong link between eating these types of meats and getting cancer. As you're cutting back on your portion sizes of meat, consider having some meatless meals. Remember, the American Cancer Society recommendation is a plant-based diet. Here are a few ideas. You could make a burrito or quesadilla with beans instead of chicken or steak. You could add extra vegetables to pasta, pizza, or stir fries. Add nuts and chickpeas to a salad. Add beans or lentils to soup. Stir peanut butter into oatmeal or non-fat yogurt at breakfast to add a little extra protein. Prepare beans as a side dish, like confetti bean salad or New Orleans red bean salad. The third recommendation is limiting alcohol. Alcohol is associated with risk for 6 cancers, and even drinking a small amount daily increases breast cancer risk in women. All types of alcohol seem to have the same effect on cancer risk, and at this time, a safe level of intake to prevent cancer is unknown. It is recommended for women to have no more than 1 serving per day, and for men to have no more than 2 servings per day. 1 serving of alcohol equals 12 ounces of beer, or 5 ounces of wine, and 1½ ounce of distilled liquor. The final recommendation is to be active as often as possible. Remember to sit less and move more. Besides helping a person achieve a healthy weight, Physical activity itself is important for cancer prevention. In fact, risk for 13 cancers may be reduced by physical activity alone. Any activity is good activity, but getting active more often and working harder when we do get active seems to protect us more. The guidelines for adults are as follows. At least 30 minutes a day of moderate activity, 5 or more days per week, or 15 minutes per day, 5 or more days a week of vigorous activity. These are the guidelines for children and teens. 60 minutes per day, vigorous activity at least 3 days per week, and outdoor and active play. If you or someone you know would like more information about breast, cervical, colorectal cancer, or other types of cancers, or where to obtain screenings at a reduced price, please call the American Cancer Society toll-free at 1-800-227-2345 any day, anytime, or visit www.cancer.org. Thank you for joining us today. Remember, if you have any questions,